Good morning, everybody. This is Dr. Litvin. Just saw a young man in his early 40s who came in to see me for very non-specific complaints. Over the past 6 months, he's gained some weight. He's been a little bit on the depressed side. His libido is a bit down. He's wasn't too concerned, but several days ago he noticed a lump in his neck and a few rashes, so he came in for an evaluation. So questioning him and further, there's apparently a family history of diabetes, there's some cancer, and there's also a sleep apnea, both his brother and his father. And on exam, the lump in his neck is a lymph node, which is about 2 to 3 centimeters on the right neck. His thyroid is not enlarged, and he seems to have a very narrow pharynx, and otherwise the rashes are not really significant. He seems to be euthyroid with normal reflexes, and he's slightly overweight. Looking over his vitals and then his BMI indeed is elevated at 32. Vitals are okay. We only have lab from about 6 months ago, and at that time his lipids showed an elevated triglycerides and suppressed HDL with normal glucose and normal TSH. So addressing all these issues, I told the patient that he is possibly pre-diabetic, given the fact that his BMI is elevated, there's family history of diabetes, and his dyslipidemia. And in addition to that, I told him that he might have sleep apnea and encouraged him to go for a sleep study. And then said that his dyslipidemia probably needs to be treated. I will send him to the lab to evaluate all that, and I offered to send him to a sleep study center and mentioned to him that if he is indeed with sleep apnea, if that's a positive evaluation, that contributes to his pre-diabetes getting worse. I encouraged him to lose at least 10% of his body weight and to stay a little fit, and told him that his lab shows that he is indeed pre-diabetic, that I might start him on a metformin. And in addition, I told him that I did not want to check his testosterone level at this time because I mentioned that his testosterone might very well be a bit lowish given all the other problems that he has. And I encouraged him to lose some weight, get a little more fit, and on his second visit, if he doesn't feel that his libido is improved, we'll go ahead and check his testosterone levels. So the patient is really a very common presentation. I see lots of these patients whose lifestyle has deteriorated, and they're overworked, they're too busy, they've gained some weight, they're not fit. And consequently, various family medical issues come to the fore, and possibly even deserve a diagnosis and therapy. But I think that most of his issues could be circumvented by weight loss, some physical activity, and I've encouraged him to do that. Hopefully this was advantageous and maybe even entertaining. So stay in touch, and we'll talk when I have another case.